time for the This Is How We Do It section in our program. We'll talk about the mental health helpline, from intervention to psychotherapy for business. Here to talk to us about it, Tadeusz Reimus. Hello, Tadeusz. Can you see me, hear me?
Hello, Łukasz. I can see you. It's really nice to see you. Hello, everyone.
Great to have you with us. Hi.
Yeah.
We have a very,
I'm really happy.
Yeah, you run this project, mhhelpline.com, and if I understand it correctly, you had scheduled and planned this project for launch in June this year, but given the circumstances, the lockdown and the coronavirus situation that really started for Poland in March, you decided to pre-schedule the launch for various reasons. Can you tell me about those reasons? Why?
Well, the mental health helpline, it's the safe and professional place for psychological support. So with the team, we wanted to give the best support from the psychologists, psychotherapists, interventionists, and psychiatrists for our clients. And yeah, we wanted to kick off this project on holidays, but then pandemic happened. And our clients were asking us to speed up the project because the employees were struggling with the depression, anxiety attacks. And I think everyone here who is listening knows that there were hard times. So from this time, Mental Health Helpline is providing psychological support in a technology that is available pretty fast in 48 hours. And our clients, yeah.
Tadeusz, is it fair to say that the actual demand for those services increased dramatically? Or if you were to quantify it, what kind of increase are we talking about?
Well, you know, the WHO organization is saying that the depression rises for about from 5% to 15%, or even so 3 times. We have our statistics that during the times of the peace, let's say, from the number of employees who need to have some kind of psychological support is about 2 to 5%, but I'm talking about times of peace. In times of pandemic now, we observe that it is even 20 to 30% from one of our clients. But I think it's like
figure.
Yeah, that's the huge, because people are isolated, are feeling lonely, depressed, but they have much more exposure for crises. For example, they are worried about their seniors, about the health problems, about children, and they are pretty much alone.
And on top of that, depression is one of those challenges that have for years been largely undetected for a huge number of cases. So can you tell us more about how these estimates are created and by whom? I mean, you've mentioned the WHO projections, but...
Well, there are different types of depression, obviously, but when I will talk as a consultant and as a psychotherapist, that if you have these general symptoms, such as you do not feel any satisfaction, you have mood disorders, let's say that you are pretty much on the low level of your activity, and you have like sleep deprivation, or you sleep too much or less, that if you have this kind of symptoms in about 3 weeks, it is safe to search for some kind of diagnosis and professional care, because it means that your body, your organism is saying something important for you, and maybe it is time to take care of yourself.
Tadeusz, which brings us to the helpline as one of the proposed solutions for big organizations. When first introducing this idea, you mentioned it's both safe and professional. I have absolutely no doubt about the professional part, but I think it's also important that we say why use the word safe.
Well, we have the medical law as a company on our backs. So we wanted to be it's safe in the legal way and in the IT technological way. So all the consultancies are encrypted, and employees who want to speak with the mental health professional are just like anonymous in a sense that even HR, even we do not know if their personal data. They only have to make some kind of announcement and do the address in our platform, and afterwards they are just as safe as they can be via internet. And we have all the legal and technological certificates. Yeah.
So you're following all the legal guidelines and regulations regarding confidentiality, and I presume the stream itself is encrypted and it's not being recorded. Is that the case?
Yeah, it is not recorded, and it is not like employee cannot ask us for the personal data of the employers. It's outside party that is taking care of all the personal data.
Depression itself is a huge topic these days and likely to become even bigger, but I think it's been a social taboo. People get stigmatized for it within organizations, sometimes even. So I suppose what you're talking about, the safety, security aspects are extremely important on a purely emotional level for a lot of people, I would imagine.
Yeah, that's true. But I think that's one of the few positives in pandemia, that the depression or anxiety disorders or mental health in general is not taboo as much as it was. Because
and the other thing,
excuse me?
And the other thing, Tadeusz, now that I think about it, there is a certain positive irony to it as well, because one of the reasons why many people would not physically go to a psychotherapy session is because they would not like to be seen entering a physical building, if you like, and literally, attending the place where they sit in a queue or wait for, and someone can see them in this potentially embarrassing as they see it situation. And with the technologies available today, encrypted streams and direct consultation, that eliminates at least one important obstacle, doesn't it?
Yeah, well, exactly, Łukasz. As you were saying, we are observing like increasing the number of patients and clients, because there was this kind of barrier of the feeling ashamed or not asking for help. It's actually easier for some, of course, of our patient to get the professional help, or at least to diagnose if the problem is in the mental health area or not. So mental health should be treated exactly as physical health. So if you feel, yeah.
Tell me, please. I would imagine that it doesn't necessarily take a pandemic like COVID-19 for there to be a professional mental health helpline that people are familiar with. So I would imagine your project comes to a list. It's added to an already existing list of mental health solutions out there. Please tell me it's true, that you're not the first one or not one of the first ones.
Here in online, we are one of the first ones.
Really?
Really, yeah, it is, because we have this idea that employee should choose a mental health professional by face and by name. That's
Yes.
the exact idea of the mental health helpline, that you can see with whom you are speaking in 48
Absolutely.
hours. Yeah, because, you know, like before, if companies have employee assistance program, they have actually some kind of anonymous voice in the set phone. Of course, it is important, but well, my idea was to have like the exact support as you are having in the psychotherapy sessions, or even in psychiatric hospital, that you actually can see and be as safe as it can be in technology. So in this case, we are one of the first, if not the first, institution who is stressing this personal relationship. And you can check it
all,
if you want.
I will definitely. Tadeusz, we're living in the 21st century, which is where people spend time researching if they want to buy a new pair of socks. They read opinions, they read all the background. So it's only proper that we give them choice when it comes to something as intimate as psychotherapy. That's the kind of service, if you like, that I would imagine everyone likes to know more about their psychotherapist long before they have the first encounter. It's a very intimate thing to build trust to begin with. So tell me, because this conference is essentially about diversity, inclusion, values, equity, is it fair to say that a big multinational company cannot really talk about diversity and inclusion if they don't have a sound mental health policy? Is it a fair statement, or is it exaggerated?
No, it's not exaggerated at all. It's the truth. You know, the mental health problems are so much apparent in the business and in the corporate and not corporate organizations, that the thing is that if you want to cope with some kind of crisis, you need to take care of your mental health, or you need to just focus how healthy, mentally organized are your employees. And the younger they are, the more important it is for them. There are some research that from the generation of the let's say millennials and youngers, the reason they are changing the jobs is like from 50 to 75% via mental health issues, and it's like the huge number. Yeah. So it's safe to say that if you do not, it's safe to say that if you don't take care of your mental health, you will cease to exist as an organization. But yeah, you can just like focus on that.
We all know that when it comes to mental health, it's not like catching a virus. To diagnose properly what started a given mental problem in an individual, you need to take a look at a very complex set of factors sometimes. And I would imagine sometimes these factors can be reduced to an in-company situation and a set of circumstances that accelerated a mental health situation because of what was happening at work almost exclusively. Sometimes it comes completely from outside experience, someone's family background, traumatic experiences in a private life situation. And sometimes it's a really sophisticated, complex, very difficult to untangle set of both worlds. That would be the case. So my question is, what's the organizational view on mental health? It's a very generic question, I understand that. But is there a trend? Do organizations have a certain perspective on not only accountability, but creating systemic solutions for mental health?
Well, there are like different levels of taking responsibility of mental health, and some of our clients are pretty much, the pioneer of taking the responsibility. But like work in general is good for mental health, and actually, as you were saying, that in the workplace you will see that something is wrong, and at the first place, not in your home. you have to mobilize yourself to work. So your boss will see that something is wrong, maybe even before your spouse or your kids or your family.
Sure.
But yeah, and that's why we wanted to help as fast as possible in our helpline. But the other thing is that negative working environment can lead to some kind of physical and mental health problems, and that's the other part.
Can we take it to a level of a specific example? If you were to advise companies how to cope with their in-company crises, what steps are priorities for them?
Well, from my point of view, like implementation and some kind of enforcement of health and safety policies and practices. For example, like identification of distress, like providing some kind of support is crucial. Informing your people, your staff that some kind of support is available and some is not. Organizations should just like make programs for this psychological first aid, let's say, to ensure that your supervisor will, for example, know how to have this conversation with the diagnosis goal and with the supportive goal. It is the competence that can and should be trained. Like you need to recognize the rewards itself that you taking care of your mental health and work-life balance, because it makes your organization stronger and much more dynamic.
Which clearly shows us that it clearly shows us, Tadeusz, that it's a very big topic, very broad, lots of legislation, regulations, and best practice involved. But could you please, can we try and narrow it down a little to specific client solutions that you have been impressed by? Because obviously one thing to do is to establish a systemic link with either an organization or a helpline like yours. But can you think of maybe 3 examples of best practice that you as a psychotherapy professional have been really impressed by, actually on the market?
Yeah, well, our clients have a lot of best practices. One of our clients just wanted to train like everyone, exactly everyone, from the first psychological aid. And there were like thousands of people and hundreds of trainings conducted. And actually they did a pretty good job, because like in this organization, huge global corporate business, we have the information that these kind of conversations are just like on weekly basis. How do you feel? What can I do to make you feel better? When your supervisor is just like putting you at the exact spot that he or she is seeing that you don't seem like yourself. Are you okay? You're taking care empathically of your employees. And it creates a huge cultural change in all the management. And I think it's one of the best practice that they are able, and they have the competencies of the first mental health help and support, and making this kind of conversation. The second one, I'm pretty impressed of one of our clients, maybe two, how they react on the time of crisis. For example, when someone died in the accident, or the employee miscarried, or the parent of one of the employees sick in coronavirus. So we have this client who has very strict policy what support will be like. and what should managers do, what should employees do, if they should ask or not for the death or for the some kind of crisis. And we had this procedure of coming back from the depression episode to work, and very few companies even thought about this kind of treatment and support. And one of our companies will just say, on monthly basis, the half a year is a good time to take back and support the employee who is depressed. The third stuff, I think it's a very best practice to educate via webinars here, via consultancy. And one of our clients just have this idea that they should provide all the support they can give, including very long psychotherapy process if someone needs it. So I'm a psychotherapist, so I know that the treatment in psychotherapy can be even 3 years or 4 years or 5 years. So one of our clients are saying just like, oh, okay, that's enough. We have so much importance in our employees that we will pay for that, not because someone is forcing us, but we want to really pinpoint these mental health problems. And the idea is that if someone is taking care of themselves 1 hour a week, he or she will be a better employee. And it is the case that the long process can be paid by the company. And I'm pretty impressed by that and respect that. Of course, not company. Yeah.
These are
I can talk about it all the time, as you can see.
Wonderful, wonderful. Unfortunately, we have certain time limitations, and I'm only left with enough time to ask you a yes or no question. But what you're telling me is actually very positive news, because for years, especially people on the outside, people who only have stereotypes about big corporate multinationals, they think these are profit-centric, profit maximization, productivity-focused organizations. And what you're saying really tells me that if these things are emerging into positive trends, we are starting, slowly and gradually perhaps, but definitely as a trend, to live in the age where values, real values, not on paper values, are beginning to matter for corporate ecosystems more and more, establishing long-term reputation, long-term values for the company, which is not just, as I said, on glossy paper, but something more to it. There is more sense that once you become an employee, you're part of something more important, part of something broader. And it's not that when you have difficulties, where you're going through psychological stress, we will abandon you and ask you to go because you're not meeting the KPIs any longer, right? So it's a very different world, isn't it?
Yeah, it is. That exactly what you are saying is that money doesn't buy happiness. It's not that quite simple. Money doesn't buy any satisfaction. If you are in the form of some of psychologists can say like hedonic treadmill, you will never feel you have enough. You have the business. That's when as I understand you, that you need to focus on your satisfaction, on your values of something deeper, not on money itself, but what it can be bought, and there's the lasting value of relations, of people, of your employees. And yeah, that's the positive trend. I would say that we need to focus not on the KPIs, but on the of that, how much satisfaction I can have from my work, from my relationship, and from my meaning area of my work. So yeah, I'm really happy that it is like that.
And all of the above are likely to influence KPIs, productivities, and all the aspects that matter for a company to be also successful in the market. Tadeusz, I couldn't hope for a more positive closing to our discussion. Thank you for finding the time, and it's been wonderful to talk to you. Thank you once again.
Thank you once again, and take care, and a lot of health.
Tadeusz Reimus, mhhelpline.com. Once again, congratulations on this initiative and best of luck. Thank you.